Today we are going to talk about PCOD and PCOS. These are two conditions that are commonly affecting a lot of young girls and women nowadays. So let's understand what are the differences between these two, how can we treat it and how can we manage it. So PCOD or polycystic ovarian disease is nothing but a problem with improper ovulation, which leads to the accumulation of immature or very small eggs over a period of time, which start developing into cysts. And these the cysts that develop ultimately can cause the release of a lot of hormones, especially the male hormones called as the androgens. So over a period of time, it affects fertility and can cause a lot of problems such as disruption of the menstrual cycle. While PCOS is known as polycystic ovarian syndrome. So this is a little less common compared to that of PCOD, where you see this has led to hormonal disturbances, and this hormonal disturbances disrupts the reproductive hormones such as estrogen and progesterone. So over a period of time, what happens is in the condition of PCOS, it can lead to infertility. So now when we look at both these conditions, what we can understand is PCOD is reversible and can be managed more comparatively than PCOS, which has to be managed more medically. The symptoms of both these conditions are quite similar. The most common symptoms of these two conditions are irregular periods, where there can be either decreased or heavy bleeding, excessive facial and body hair, acne, weight fluctuations, either the weight may increase or it may decrease, tiredness and fatigue. Then there are mental health issues such as depression, ovarian cysts, skin darkening around the neck, under the breast and groin area, hair thinning. Now let's talk about the levels of fertility in both these conditions. In PCOD, the fertility is less affected or not affected in some cases. So many women can successfully have children, but few will require a bit of help from the doctors for them to conceive. Whereas in PCOS, fertility can completely be affected and many women experience infertility or are unable to have children. Complications of both these conditions are again similar, but in PCOS we see the more number of complications such as bleeding or intrauterine bleeding, infertility, increased sugar levels, increased blood pressure. There's something called as fatty liver that is happening in most of the women. Some women have snoring problems or something called as sleep apnea. Women may also have miscarriages and also premature deliveries. So your next question would be, how do we treat or manage these conditions? So the first thing we need to look at is how do we manage the hormonal imbalance? One of the common side effects of both these conditions are insulin resistance. So insulin resistance can further lead to diabetes in the later life. So if we need to manage this, the first thing is we need to understand what is the kind of diet that one can follow. Not only that, in the treatment of PCOD and PCOS, poor metabolism is also another side effect. So that can lead to weight fluctuations. So that is why another way we can again approach this condition is with a healthy diet. So the treatment for both these conditions can be diet and lifestyle changes. So dietary changes can be the higher intake of more of complex carbohydrates. So we have two types of carbohydrates such as complex carbohydrates and simple carbohydrates. So complex carbohydrates can be brown or parboiled rice, atta or whole wheat products, whole pulses such as chana and moong, millets such as ragi and bajra, and all fruits and vegetables. So simple carbohydrates can be such as sugar and maida or refined flour, which is there in most of our processed foods that we eat. The next best approach to managing the diet for these conditions are a good protein intake or an ideal protein intake. Protein can be availed from a lot of different sources such as both vegetarian as well as non-vegetarian proteins. So vegetarian proteins usually come from milk products and from pulses and dal, whereas non-vegetarian proteins can come from eggs, can come from fish and can come from white meat as well as red meat. So what about fats? There's always a question. Can we consume fat? Yes, fats are quite healthy for the maintenance of a very good metabolism. Healthy fats such as nuts, seeds, extra virgin, and filtered oils are really good for our health. So now that we've learned what's really good for us, let's understand what should not be there in our diet or what we need to avoid in our diet. So foods to avoid can be processed foods which are made up of high sugar, lot of maida or refined flours and trans fats, because all these foods together can disturb the hormones. Avoid a lot of fried foods, especially those that are fried in refined oils or reused oils. Avoid fruit juices, soft drinks, which can increase your insulin resistance. Add a lot of fiber, because adding a lot of fiber will decrease your insulin resistance, help you lose weight, and also manage your health better. Exercise for at least 30 minutes in a day. This will help in managing your weight as well as your hormones. A good sleep also is very important. At least 6 to 8 hours of sleep can improve your hormonal levels and definitely help you manage this condition. If you found this video informative, please do not forget to like this video and subscribe to my channel. Thank you.